Welcome to today's video. If you're preparing for the NCLEX, you're in the right place. In this video, we'll walk you through 25 practice questions covering a wide range of topics, including medical surgical nursing, pharmacology, pediatrics, maternity care, and mental health. These questions are designed to mimic the style and difficulty of the actual NCLEX exam, helping you build confidence and sharpen your critical thinking skills. Each question comes with detailed explanations, so you'll not only know the correct answer, but also understand the reasoning behind it. Whether you're studying for the first time or brushing up on your knowledge, this practice test is a great way to assess your readiness and identify areas where you might need more focus. So grab a notebook, stay focused, and let's dive into these 25 NCLEX-style questions together. Don't forget to pause the video if you need more time to think, and feel free to leave a comment if you have any questions. Let's get started. Question 1. Which statement is true about minors and medical consent? Choices. A. Minors cannot consent to any medical treatment. B. A minor with a sexually transmitted disease, STD, can consent to treatment. C. A parent or guardian must always sign consent for minors. D. Minors can only consent to emergency care. Answer. B. A minor with a sexually transmitted disease, STD, can consent to treatment. Explanation: minors with STDs are legally allowed to consent to treatment without parental permission under privacy laws. This ensures they receive necessary care while protecting their confidentiality. The rationale behind this exception is to encourage minors to seek treatment for sensitive health issues without fear of parental disclosure. However, for most other medical procedures, minors typically require parental or guardian consent unless they are emancipated or meet specific legal exceptions. Question 2. A patient arrives for same-day surgery wearing expensive jewelry. What should the nurse tell the patient? Choices. A. You can keep your jewelry on during the procedure. B. We'll put the jewelry in an envelope and we'll both sign it before placing it in the safe. C. Give the jewelry to a family member to hold. D. The hospital is not responsible for lost or stolen items. Answer. B. We'll put the jewelry in an envelope and we'll both sign it before placing it in the safe. Explanation. To ensure the safety of the patient's valuables, the nurse should follow proper hospital protocols. This includes documenting the items, placing them in a sealed envelope, and storing them securely. Both the nurse and patient should sign the envelope to confirm the items were received and stored properly. This process protects the hospital from liability and ensures the patient's belongings are returned safely after the procedure. Question 3. A patient with alcoholism reports their last drink was 3 days ago and they are feeling shaky. What is the nurse's priority goal? Choices. A. Provide emotional support. B. Ensure physiological stability. C. Educate the patient about the dangers of alcohol. D. Refer the patient to a support group. Answer. B. Ensure physiological stability. Explanation: the patient is at risk for alcohol withdrawal syndrome, which can progress to life-threatening complications such as delirium tremens, DTs. Symptoms of DTs include severe confusion, hallucinations, seizures, and cardiovascular instability. The nurse's priority is to stabilize the patient's physical condition by monitoring vital signs, administering medications like benzodiazepines to prevent seizures, and ensuring hydration and electrolyte balance. Once the patient is stable, the nurse can address emotional and educational needs. Question 4. A healthcare provider writes a prescription for eye drops using unclear abbreviations. What should the nurse do? Choices. A. Administer the medication as prescribed. B. Contact the healthcare provider to clarify and rewrite the prescription. C. Ask the pharmacist to interpret the prescription. D. Educate the patient on how to use the eye drops. Answer. B. Contact the healthcare provider to clarify and rewrite the prescription. Explanation: unclear or ambiguous abbreviations in prescriptions can lead to medication errors, which pose serious risks to patient safety. The nurse should never assume the meaning of unclear abbreviations. Instead, they must contact the healthcare provider to clarify the order and request a rewritten prescription. This ensures the patient receives the correct medication, dosage, and frequency, reducing the risk of harm. Question 5. Which task should never be delegated to unlicensed assistive personnel? UAP. Choices: A. Assisting with bathing and feeding. B. Measuring and recording intake and output, checking whether blood is still infusing. D. Transporting a patient to radiology. Answer: C. Checking whether blood is still infusing. Explanation: monitoring blood administration requires nursing judgment and is beyond the scope of UAP responsibilities. UAPs are not trained to recognize complications such as transfusion reactions, infiltration, or signs of fluid overload. The nurse must oversee blood transfusions and assess the patient's response to ensure safety. Tasks like assisting with ADLs, measuring intake output, and transporting patients are within the UAP's scope of practice. Question 6. For a stable patient recovering from a heart attack, which task can the nurse safely delegate to a UAP? Choices: A. Administering medications. B. Measuring and recording intake and output. C. Assessing the patient's pain level. D. Educating the patient about heart-healthy diets. Answer: B. Measuring and recording intake and output. Explanation: UAPs can perform tasks that do not require nursing judgment, such as measuring and recording intake and output. Administering medications, assessing pain, and patient education are responsibilities that require the expertise of a licensed nurse. Delegating appropriate tasks allows the nurse to focus on higher-level responsibilities while ensuring the patient's needs are met. Question 7. If a nurse applies restraints without a physician's order or the patient's consent, what legal charge could the nurse face? Choices: A. Negligence. Battery. C. Assault. D. Malpractice. Answer: B. Battery. Explanation: battery involves unauthorized physical contact. Applying restraints without consent or a physician's order constitutes battery because it violates the patient's right to autonomy and freedom from harm. Restraints should only be used as a last resort to protect the patient or others, and they require a physician's order and frequent monitoring to ensure the patient's safety and dignity. Question 8. A nurse observes a nursing assistant attempting to move a post-stroke patient by pulling on their weak arm. What should the nurse do? Choices: A. Allow the assistant to continue. B. Intervene and instruct the assistant to use proper lifting techniques. C. Report the assistant to the supervisor. Chubwent. D. Document the incident in the patient's chart. Answer: B. Intervene and instruct the assistant to use proper lifting techniques. Explanation: pulling on a flaccid or weak arm can cause injury, such as shoulder dislocation or nerve damage. The nurse should immediately intervene and instruct the assistant to use proper lifting techniques, such as a lift sheet or mechanical lift, to ensure the patient's safety. Proper body mechanics are essential to prevent injury to both the patient and the caregiver. Question 9. In a primary nursing care model, what is a unique responsibility of the nurse? Choices: A. Collaborating with other nurses to provide care. B. Providing all care for assigned patients during the shift. C. Delegating tasks to UAPs. D. Focusing on discharge planning. Answer: B. Providing all care for assigned patients during the shift. Explanation: in the primary nursing model, one nurse is responsible for all aspects of care for their assigned patients during their shift. This includes assessment, planning, implementation, and evaluation of care. The primary nurse serves as the main point of contact for the patient and coordinates care with other healthcare providers. This model promotes continuity of care and strengthens the nurse-patient relationship. Question 10. A nurse is training a new LPN about caring for a suicidal patient. Which statement by the LPN indicates a need for further education? Choices: A. I'll check the patient every 15 minutes. B. I'll remove all sharp objects from the room. C. I'll document the patient's behavior every hour. D. I'll ensure the patient is never left alone. Answer: A. I'll check the patient every 15 minutes. Explanation: suicide precautions require irregular checks to prevent the patient from predicting when they will be observed. Checks should vary in timing, e.g., 10 minutes, then 5 minutes, then 8 minutes, to ensure the patient cannot plan self-harm during predictable gaps in monitoring. Removing sharp objects, documenting behavior, and ensuring constant supervision are all appropriate measures for suicide prevention. Question 11. If a patient cannot read or write, how should the nurse handle obtaining informed consent? Choices: A. Have a family member sign the form. B. Ask the patient to make an X as a signature. C. Sign the form on behalf of the patient. D. Skip the consent process. Answer: B. Ask the patient to make an X as a signature. Explanation: when a patient cannot read or write, the nurse must ensure they fully understand the procedure and its risks and benefits. The nurse should read the consent form aloud in the presence of 2 witnesses. The patient can then make an X or another mark as their signature, and the witnesses will sign to confirm the patient's understanding and consent. This process ensures the patient's autonomy and legal compliance while respecting their limitations. Question 12. A patient is in septic shock. Which intervention should the healthcare provider administer first? Choices: A. IV fluids. Broad-spectrum antibiotics. C. Vasopressors. D. Corticosteroids. Answer: A. IV fluids. Explanation: in septic shock, the priority is to restore perfusion and stabilize the patient's hemodynamic status. Administering IV fluids, fluid resuscitation, is the first step to increase intravascular volume, improve blood pressure, and enhance tissue perfusion. Once fluid resuscitation is initiated, broad-spectrum antibiotics should be administered promptly to target the underlying infection. Vasopressors and corticosteroids may be used if the patient does not respond to fluids and antibiotics. Question 13. A patient signed consent for a hernia repair, but later expresses confusion about the procedure. What should the nurse do? Choices: A. You don't need to worry about that. B. I'll ask your healthcare provider to explain the procedure again. C. The surgery won't affect your pouch. D. You can discuss this with your employer. Answer: B. I'll ask your healthcare provider to explain the procedure again. Explanation: informed consent requires that the patient fully understands the procedure, its risks, benefits, and alternatives. If the patient expresses confusion, the nurse must ensure the healthcare provider re-explains the procedure in detail. This ensures the patient's autonomy and legal compliance. The nurse should also verify the patient's understanding and document the discussion in the medical record. Question 14. What does it mean for a nurse to act as a patient advocate? Choices: A. Make decisions for the patient. B. Follow the healthcare provider's orders without question. C. Assess the patient's perspective and explain it when necessary. D. Avoid discussing treatment options with the patient. Answer: C. Assess the patient's perspective and explain it when necessary. Explanation: patient advocacy involves understanding the patient's values, preferences, and concerns, and ensuring their voice is heard in decision-making. The nurse acts as a liaison between the patient and the healthcare team, explaining medical information in a way the patient can understand, and supporting their right to make informed decisions. Advocacy also includes protecting the patient's rights and ensuring they receive safe, high-quality care. Question 15. A 10-month-old baby is admitted with a fractured femur. What should the nurse do first? Choices: A. Assess the baby's pain level. B. Ask the parents how the fracture occurred. C. Apply a splint to the affected leg. D. Administer pain medication. Answer: B. Ask the parents how the fracture occurred. Explanation: fractures in non-ambulatory infants are highly suspicious for non-accidental trauma, child abuse. The nurse's first priority is to assess the circumstances of the injury by asking the parents open-ended questions. This helps identify potential abuse and ensures the child's safety. Once abuse is ruled out or addressed, the nurse can focus on pain management and treatment. Question 16. Which legal document outlines a patient's wishes for medical treatment if they become unable to make decisions? Choices: A. Living will. B. Durable power of attorney. C. Informed consent. D. Advanced directive. Answer: D. Advanced directive. Explanation: an advanced directive is a legal document that outlines a patient's preferences for medical treatment if they become incapacitated. It may include a living will, specific treatment preferences, and a durable power of attorney for healthcare, appointing a surrogate decision maker. Advanced directives ensure the patient's autonomy is respected even when they cannot communicate their wishes. Question 17. A patient has lab results showing low T3 and T4 levels and high TSH. Which symptom should the nurse expect? Choices: A. Weight loss. B. Tachycardia. C. Heat intolerance. D. Fatigue. D. Fatigue. Explanation: low T3 and T4 levels with elevated TSH indicate hypothyroidism, a condition where the thyroid gland is underactive. Common symptoms include fatigue, weight gain, cold intolerance, dry skin, and constipation. These symptoms result from a slowed metabolism due to insufficient thyroid hormone production. The nurse should monitor for these signs and provide education about thyroid hormone replacement therapy. Question 18. Which patient can be prevented from leaving the hospital against medical advice? AMA. Choices: A. A patient who feels better and wants to go home. B. A patient who cannot afford the treatment. C. A patient who is tired of waiting for test results. D. A patient who threatens to harm their former spouse. Answer: D. A patient who threatens to harm their former spouse. Explanation: patients who pose a danger to themselves or others can be legally detained even if they wish to leave AMA. This includes patients who make threats of violence or exhibit suicidal behavior. The healthcare team must ensure the safety of the patient and others while providing appropriate care and interventions. Question 19. A nurse grabs a patient's foot and yells, "Shut up!" What legal charge could the nurse face? Choices: A. Assault. Battery. C. Negligence. D. Defamation. First me. Answer: B. Battery. Explanation: battery involves unauthorized physical contact. The nurse's actions grabbing the patient's foot and yelling constitute battery because they involve physical contact without the patient's consent. Assault, on the other hand, involves the threat of harm without physical contact. The nurse could face legal consequences for violating the patient's rights. Question 20. For a terminally ill patient, what should guide treatment decisions? Choices: A. The family's wishes. B. The healthcare provider's recommendations. C. The nurse's judgment. D. The patient's expressed wishes. Right? Answer: D. The patient's expressed wishes. Explanation: end-of-life care prioritizes the patient's autonomy and preferences. The patient's expressed wishes, as documented in an advanced directive or through discussions with the healthcare team, should guide treatment decisions. If the patient is unable to communicate, their designated surrogate decision maker, e.g., durable power of attorney, should make decisions based on the patient's known preferences. Question 21. A nurse plans to work as a travel nurse in another state. How can they learn about the scope of practice in that state? Choices: A. Ask a colleague. B. Review the American Nurses Association, ANA, guidelines. C. Consult the state's Board of Nursing. D. Refer to the Nurse Practice Act of the new state. Answer: D. Refer to the Nurse Practice Act of the new state. Explanation: the Nurse Practice Act, NPA, defines the legal scope of nursing practice in each state, including roles, responsibilities, and limitations. Travel nurses must familiarize themselves with the NPA of the state, where they will be working to ensure compliance with local regulations. The state's Board of Nursing can provide additional guidance and resources. Question 22. What is the purpose of the diagnosis-related group, DRG system? Choices: A. To standardize nursing care plans. B. To determine reimbursement for specific diagnoses. C. To guide patient education. D. To track hospital admissions. Answer B. To determine reimbursement for specific diagnoses. Explanation: the DRG system is used by Medicare and insurance companies to classify hospital cases into categories based on diagnosis, treatment, and length of stay. Each DRG has a fixed reimbursement rate, which encourages hospitals to provide cost-effective care. This system helps control healthcare costs while ensuring patients receive appropriate treatment. Question 23. A nurse is moving to another state. What is the best resource to understand the nursing practice rules there? Choices. A. The American Nurses Association. A.N. A. B. The state's Board of Nursing. C. The Nurse Practice Act of the new state. D. The Nursing Licensure Compact. NLC. An answer. C. The Nurse Practice Act of the new state. Explanation: the Nurse Practice Act, NPA, outlines the legal scope of nursing practice in each state, including licensure requirements, roles, and responsibilities. Nurses moving to a new state must review the NPA to ensure compliance with local regulations. The state's Board of Nursing can provide additional guidance and resources. Question 24. A nurse sees a staff member reading a celebrity patient's medical record without authorization. Which law is being violated? Choices. A. The Patient Self-Determination Act. B. The Health Insurance Portability and Accountability Act, HIPAA. C. The Americans with Disabilities Act, ADA. D. The Civil Rights Act. Answer: B. The Health Insurance Portability and Accountability Act, HIPAA. Explanation: HIPAA protects patient privacy and prohibits unauthorized access to medical records. Accessing a patient's medical record without a legitimate reason or authorization is a violation of HIPAA and can result in legal consequences, including fines and disciplinary action. Question 25. When preparing a patient's chart for surgery, which document is not required before transport? Choices. A. Informed consent form. B. Surgical checklist. C. Anesthesia record. D. Pre-operative nursing notes. Answer: C. Anesthesia record. Explanation: the anesthesia record is completed during and after surgery, not before. The informed consent form, surgical checklist, and preoperative nursing notes must be completed and verified before the patient is transported to the operating room. These documents ensure the patient's safety and readiness for surgery. Great job making it through all 25 questions. We hope this practice test helped you feel more confident and prepared for the NCLEX. Remember, the key to success is consistent practice and understanding the reasoning behind each answer. If you found this video helpful, don't forget to give it a thumbs up, subscribe to our channel for more NCLEX prep content, and hit the notification bell so you never miss an update. If you have any questions or want us to cover specific topics in future videos, leave a comment below. We'd love to hear from you. Keep studying, stay focused, and remember, you've got this. Good luck on your NCLEX journey, and we'll see you in the next video. Until then, happy studying!